name is Rinda Blom. I'm the director of the Directive Play Therapy Training Center in Bloemfontein, South Africa. This morning I'm going to talk a little bit about the play therapy dimensions model, which is a model of Ken Gardner and Lori Yasenek in Canada. And it's a very useful model to use when doing assessment in play therapy. Specifically also if you want to determine if you want to work more directively or more non-directively. So in play therapy there's two main distinctions. You can either work non-directively, which is called the child-centered approach, merely where you're very non-directive, you introduce the child to the playroom and the child can play any way the child wants, and the therapist make use of reflective statements and tracking and reflection of feeling and encouraging statements to track and reflect what the child is doing. So the main principle is you don't interfere. And then on the other side you can work very directively, where normally the therapist plan the activity beforehand, and the child would come in and the therapist would say, well, today we're going to make a story in the sand, or today we're going to do a puppet theatre or a board game. So, but then there's also a kind of an in-between directive and non-directive. So according to the model of Ken Gardner and Lori Yasenek, we can distinguish in play therapy assessment and work between a level of consciousness and unconsciousness on the one hand. So you can the child can either be very unconscious of the problem that lead to the symptomatic behavior. Maybe it's early childhood pre-verbal trauma that the child don't know about, or that's repressed and unconscious, or the child can be very conscious of the reason why they are in therapy. So, for example, in terms of very unconscious, maybe the child was exposed to violence, scenes of violence in the house at an age of 2 years, 3 years old, and don't remember that, but now is acting with behavior that shows that there's a problem, maybe aggressive behavior or extreme anxiety levels. Consciousness, the child comes into the playroom, the child knows exactly that he or she is there because maybe he's bullied at school, or mom or dad is busy divorcing, or maybe they've moved from one town to another and the child has adaptation problems, or maybe whatever other reason. But the child now it's conscious, the child don't need to safe distance between him or herself and the toys and symbols, and so the child you can start on a conscious level. So consciousness, unconscious, and then on the left side, like I said, you can work very non-directive and you can work also more towards the directiveness. So in a sense, a child can be here or anywhere on this line between consciousness and unconsciousness, and that is what we determine in our assessment. And then the therapist can work from very non-directive to in between directive and non-directive to very directive. At the end, this forms 4 quadrants. So, and that is what I want to demonstrate and talk a little bit about. So the quadrant 1 is active utilization. That is what that is called, and we will talk about that. Quadrant 2 is open discussion. So that will be when there's consciousness and there's directiveness, open discussion and exploration. Quadrant 3 is called non-intrusive responding. And that is when you work, the child has a high level of unconsciousness and you work very non-directive. And then quadrant 4 is called co-facilitation, and that is where there's unconsciousness, but the therapist moves more towards directiveness. Okay, so let's take them one by one now, and we're going to start off with quadrant 3, non-intrusive responding. So quadrant 3 is when the therapist in no way intrude in the play. It's totally non-directive, and you look at the play theme. So this is exactly the model that I teach in my introductory play therapy workshop in terms of child-centered. Just to make a short summary of it, so the child come in, you would say to the child, this is our special playroom. In here you can play in almost any way you like. You might introduce the child to the playroom, so there is, maybe you would show to the child, here's our sand toys, and there's a section for art and craft, and the dollhouse section and so. And then you, as a therapist, would sit on a chair and you would reflect what the child is doing. So let's say, for example, the child takes this basket of blocks and the child starts building something, and the child is talking, and the child say to you, I'm building a house. Then you would reflect by saying, you're building a house. Or maybe the child would say, I want this house to be very big and strong. And you would reflect back what the child is saying. If the child is not talking, you would make use of tracking, so you would track what the child is doing. And you are not allowed to label the object, so you will just say, for example, you are putting that there, you are putting her there, you are pushing that across, etc. Now, in the non-directive play, you look most specifically to play themes, and there's a whole bunch of play themes that you can have: themes of aggression, of power and control, of mastery, of nurturing, of rescuing play. You can get sexualized themes, sexualized play, and then through the themes, the child literally tells us 4 things. This is what happened to me in my life. This is how I feel about what happened. This is how I feel about myself, and this is what I need most now. So, yeah, and when we work in this specific quadrant that I've just showed you here, you would stay in the non-directive level as I've just illustrated. The next quadrant, now that's quadrant 4. So this is called co-facilitation. So what happens here is that it's still non-directive, on the non-directive level, but as you observe the child's play, maybe you have had several play sessions, you start formulating a kind of a soft hypothesis. And what that means is that you can see through the child's play that this child is feeling very vulnerable. Maybe this child needs a feeling of power and control back in his or her life. So let's say, for example, I'm just going to get the cuffs here. So let's say, for example, the child pick up the handcuffs. You might say, for example, as I've written here, you have the handcuffs now. And so your hypothesis is that the child has a need to feel in control. And you might use a reflective statement in the session. For example, the handcuffs can keep the bad guy under control. So let's say what the child do is the child takes the cuffs and the child go and the child find, let's say in this case, this is a puppet, and the child say, this is a bad puppet and I'm going to use the cuffs to make sure that he can't come and hurt anyone anymore. And your reflective response would be, the cuffs can keep the bad guy under control and can keep you safe. The next way in which we can use applying this specific quadrant is that we can introduce helpers in repetitive post-traumatic play. So let's say, for example, the child plays out a scene of extreme violence that happens in a house. Okay, so I'm going to demonstrate here in the dollhouse now. Let's say, for example, the child plays out a scene here. So here in the dollhouse is the mom and the dad, and let's say there in the dollhouse is also a baby. Now, so here's the baby, and the baby is in the cot. And the child plays out for many, many sessions that this two-headed lion comes, and the two-headed lions open the house, the doors of the house, and kick all the furniture down, and then attack the mum and dad, and kill them, and then take the baby and carry the baby to maybe a haunted house or something. Let's say, let's use this and throw the baby in there. And now the lion is walking the whole day next to the haunted house, so the baby cannot come out and there's no one taking care of the baby. So if this has happened many times, so let's go back now and we pretend this is the next session. So the child go and play exactly the same theme. Mom and dad on the bed and the baby in the cot. And you know, it's night, and let's say the doors were closed. And then the lion come and the lion hit and hit and hit and hit the door and open the door and climb up and is on his way to do the same. How you would interfere in the play on the symbolic level is that you would bring in a strong guy or miniature and like that can act like a rescue guy. And now you would say, like, you would interrupt the play and you would say, and then just before the lion could harm the mum and dad, a very, very strong man came in and he said, this is enough. And then he come and with one, it only took him one hand and he threw the lion out. And he took the lion, he carried the lion to the prison and throw the lion in the prison. And he come back and he say to the mum and dad and the baby, you are all safe now. Right, so that would be another way that you can interfere in an example of interfering in post-traumatic play. Okay, then amplification would be another way, and we are still working in the same quadrant. So let's look at the following scene. So let's say in the sandbox, the child wants you to play with, and there is two warring scenes. So the child gives you a certain amount of soldiers, and the child maybe give him or herself a certain amount of soldiers, but the soldiers of the child is much more and much stronger. Maybe the child give himself 2 tanks as well, something like that. No. And amplification would be where you play with the child, you stay in the symbolic level, but in your play, you would talk and you would say, for example, oh, I'm so scared, I don't know what we're going to do, there's so many soldiers, and I wonder if someone will be able to help us. And then you see what the child is doing. And this would be specifically applicable if the child maybe is in a position of feeling very vulnerable, but the child is now playing it out by projecting you, or you as a therapist taking the vulnerable side. So in the amplification, what you do is when you play out and you say what you think in that soft hypothesis, what the child is feeling, you amplify on that. So you make it bigger so that maybe the child can start to integrate that on conscious level. So you would play maybe out a scene of extreme vulnerability, and you would say, I wonder if there would be a place where we can hide, and what can we do so that they don't kill us, and maybe we must go under the sand or run away, or something like that. But you stay in the symbolic level. And that is what that specific quadrant is about. So we have through that emotions that feels trapped becomes free. And in this example that I've just done, we talk specifically, we look at the child's feelings of overwhelm and vulnerability. Okay, now we're going to move to quadrant 1, and quadrant 1 is active utilization. And how this works is that the therapist briefly enters the play and make a statement towards the child in terms of maybe this can be how it is in your life. So I'm going to use an example again to illustrate what I mean. let's say, for example, sorry, I'm just taking this now out. So let's say, for example, the child is playing out, the child is building a house, and you just reflect the theme. So the child is building a house, and you've already done your assessment, and you know that the child has a very abusive, let's say in this case, stepdad. So the mum and dad is divorced, but there was scenes of violence and abuse in the house. So let's say the child put this that, and then put a wounded, this is a wounded man at this side, and a fierce dinosaur on this side. That maybe might act as a symbol of the abusive stepdad. So let's say, for example, the child now plays out, and the child say in the play, so I'm the child now, oh, my leg is so sore, I really need to get to a hospital, I wonder who can help me, but I'm so scared of that dinosaur. And maybe now he plays the role of the dinosaur, and the dinosaur saying, "Oh, I can't wait for that wounded man to come out. I'm going to eat him finally. Look at my angry mouth." Oh, I'm so scared. I really don't know where I will get help. Now, what will happen now is if the therapist interfere here and just make a very short, gentle statement like, "This sounds exactly how you felt when your stepdad was bullying you." Or this sounds exactly like you felt when your stepdad was maybe favoring your sister. So let's take now that scene, and let's take and just get someone that can be the sister. So maybe what he could play out is, here is the sister, and here is him, and they are both playing here, and now the favoritism would come in, like, let's say they are in big danger, and the dinosaur is, oh! And then the dinosaur comes out and say, "Oh, my favorite little child, let me help you, let me carry you to safety." And maybe the child plays out that the dinosaur says it, "And you can just stay here because you're useless," and then carrying the daughter. And if the therapist then make a short comment like, "This sounds exactly like you told me you feel at home when your stepdad is favoring your sister," and then the child might stop playing and maybe just say yes, and then go on and play, and so then still play in the symbolic form, and you keep on reflecting. So what happens in this quadrant is you just make a short statement to start to link what the child is playing with the child's real life, but not in an open discussion in terms of a long discussion on that now, depending on the child's reaction. So if you just say that, and the child might react on that or not react on that, and then the play goes on. So that is this quadrant. So here I've written the therapist side, so it's exactly like you feel when your stepdad favor your sister. And this is a kind of statement in intervention that we will only do if we already have a thorough, trustful relationship with the child, as well as we are in the working stage of therapy. So this is not something that we would do in the initial phases if the child doesn't have good ego strength, or maybe the child is still making use of a lot of defenses. Now, because that will make the child move more towards unconsciousness and making use of more rigid defenses. Okay, and here is the last one that I want to explain, and this is quadrant 2. And quadrant 2 is refers into what we also do when we do total directive play therapy. In other words, very directive, very open discussion. We know exactly what we're working on, and we talk about that. The therapists provide the structure, and that can be board games, or that can be throwing of a dice and discussing that, or card games. Okay, so for that demonstration, I'm going to move here. So this is, for example, a Jenga game, And there is self-esteem card. So what happens is when you pick out a specific block, a color, you have to read the question on that. For example, what clothing always looks good on you? That is the question here on the orange block. So if you, for example, took out a, just get out the card, if the child pick out a green, the question could be, who can you talk to when you're having problems? So very, very directive. So there is one example. In other words, me and the child now, we are working on the child's self-image and self-esteem, and we're making use of a specific board code. Another example can be this Find the Feeling cards, where you can play, for example, Snap. And when the child picks a specific feeling card or have a specific feeling card in the hand, so here is relax right now, the child have to say, when do I feel like that? And you could discuss the feelings. And now the same with the other feelings. And what you can also do in this open discussion is, because you are in open discussion, you can also move to handling strategies. So you don't just focus on when do you feel like that, but also what can you do when you feel like that. So for example, let's make a list of all the things that makes you angry. And now we're going to throw a ball to a target, and each time when you throw the ball, you have to say, I'm angry when, for example, my brother comes into my room without my permission. Or I'm angry when my parents fight and don't stop when I ask them to fight. And then afterwards, after that list, we can talk about handling strategies that the child can use. And there are a whole range of different board games and directive activities. If I think about all the Gestalt activities that I handle in my introductory play therapy workshop, directive sad scenes, I want you to build a story of how you feel about your parents' divorce, or how you feel about when you're scared at night, or puppet show. I want you to make an angry or sad puppet show, or clay play or painting or drawings. Now I want you to draw a specific drawing. Draw yourself with your favorite person, or make me a drawing of how does it look in your house on a Sunday morning and what happens. So that would be very directive. Open discussion means the child is very conscious of what is happening, as well as you can have an open discussion and be very directive. And that normally is when the child is, you don't have a lot of time, and the child has the ego strength to immediately start working on the problem. And that is, that brings us, that's the 4 levels. Just to take back our graph that I've drawn here. So there you have them. You're very non-directive, where the therapist can intervene, especially in repetitive post-traumatic play, on the symbolic level, and then a little bit more towards this, and then total open discussion. And that helps a lot with our assessment and determining on what level we want to work.